Okay, so you're welcome. Good morning, good afternoon, good evening, wherever you're logging in from. So today we'll be looking at building a data strategy, key steps for aligning your research methodology with your research goal. I believe, a good number of us here are researchers, and a good number of us here want to do researches that our methodology are actually appropriate, because a lot of times when we are designing our study, we find it difficult to actually make a decision what sort of methods to use. Are we going to use a qualitative method? Are we going to use a quantitative method? Are we going to use a mixed method? Are we going to use an experimental method? Now, these decisions, sometimes they can be cumbersome. So I am hoping that in this session, we would be able to demystify some of this and bring some clarity for, most of you. So understanding the research methodology itself. So first of all, you have to appreciate the fact that research methodology is a systematic approach. Now, systematic approach in the sense that it has a pattern. It has a process. You don't just decide on what you want to do. It doesn't work like that. You have to follow the process, the approach, the laid down guideline, the standard operating procedure that has been set up for that particular research. It's more like a policeman investigating a case of robbery. They always have a standard operating procedure in doing so. So wherever you are in any part of the world, they know what the first rule is, they know what the second rule is, they know what the third rule is. That's the same thing with research. As long as you have said in your heart that you want to do a research, you have to be prepared to follow that approach, to follow that process. You don't decide, oh, this is what I want to do, and I think I'm going to get a result for that. No, it doesn't work in that manner. For example, sample size. You don't just decide, oh, I want to, I want to use 100. I want to use 200. No. There are processes that has been designed to guide the number of participants that you're going to use for your study. You have to calculate sample size. Based on your study design, you would use that formula to calculate the sample size that you're going to use. You don't choose and say, oh, this is the number I'm going to use. No. So that's why I said research has that systematic approach. And you also have to appreciate the fact that the process is rigorous. And for you to have a reliable finding, you have to be patient and follow that process. There's no shortcut. That's why you see some people have their research published in high quality journals, while some people have their research published in any journal. The benefit of publishing your work in very good journal is that the visibility is high, more people will see it, and it's also credit to you as a researcher. So you have to appreciate the fact that choosing the right methodology and going through the right process has a way of also impacting on the validity and the reliability of your finding. When you publish that finding, should people take it serious? When you publish that finding, is it representative? Can I use that same finding that you have published in Ghana? Can I use it in Nigeria? Can it be used in Tanzania? And finally, these factors that guide the research methodology are influenced by certain perimeters, like your research goals, your research question, your data availability, your resources, the ethical consideration. They all play a significant role in the decision-making of this process. And we're going to look at them one after the other. So The scientific method. Now, I love this quote by Roland Fisher. It's in my email signature. It says, to consult the statistician after an experiment is finished is often merely to ask him to conduct a post-mortem examination. He can perhaps say what the experiment died of. And I like what some of my colleagues at my university do. Before they even commence the study, they come to me. I plan the research with them as a skilled methodologist. You don't go and meet a statistician or a methodologist after you have finished collecting the data. You start collaborating or coordinating with them. The moment you have conceptualized your title, you start working with them. Most universities have a statistical center or a methodology center. I know some universities don't. So if your university don't, you just have to identify a good statistician or a good methodologist that you can work with, you can collaborate with. Not after the research is done, you find out that you didn't do a lot of things well. And that will make you sometimes, especially in my university, you will see students, they will design their questionnaire. They will go to the field, administer the questionnaire and bring back the data only to find out that one of their objectives were not reflected in the questionnaire. And as long as an objective is not reflected in the data collection tool you have administered and you've retrieved this data, you will have to add it, create a new questionnaire, and go back to the field. That is really cost intensive. That's why when you design your questionnaire, don't just go and administer it. There's something they do, they call validity of the questionnaire. Sometimes they do content validity. Sometimes they do phase validity. You share this with your supervisors. You share this with people that are experts in that field. They take a look at it and they advise you. You share this with a statistician and say, oh, this is my objective. This is my questionnaire. Do you think the information in this questionnaire will be able to answer my 5 objectives? Then they would look at the objectives and look at the questionnaire, and they will be able to advise you if it can or not. If not, they can tell you, please add this before you proceed with data collection. That is why what I usually advise my student is, if you have 5 objectives, please ensure that each section in the questionnaire or in the data collection tool is an objective. So you have 5 objectives. Section A will probably be the social demographic characteristics. That one is usually a default. Section B can be the first objective. Section C, the second objective. Section D, the third objective, like that. If you're able to ensure that each objective or each study objective or each specific objective is a section in your questionnaire, that way you will not be able to miss anything, when you are retrieving this data. So these things are very, very, vital. So the scientific method in clear English. So these are the processes. It starts from stating the problem. It goes to formulating the hypothesis, designing the experiment, collecting the data, analyzing the data, and drawing up a conclusion. Every research you do, every study you do starts with a problem. You have observed the problem in that environment. That is why you want to carry out that research. People do research to solve problems. So whatever research you're doing, whatever research that is ongoing right now, you will realize that the primary goal of doing that research is to provide or to prefer solution to a problem you have seen. So in the field of epidemiology or in the field of public health, sometimes you may detect a problem in an environment. Maybe it can be things like an increase in malaria. Why is a particular community, why are they always coming to the clinic with malaria? You know, that may be a problem. So from that problem, you formulate a hypothesis. And that hypothesis will be associating the prevalence of malaria with factors you think may be responsible for the malaria you want to check. So probably you may want to associate the prevalence of malaria with their habits with insecticide-treated nets, with their habits of environmental cleanliness. So those are the hypotheses you may want to formulate. And in formulating those sort of hypotheses or those sort of association, in this example I'm giving right now, your null hypothesis may be there is no association between prevalence of mosquito and sleeping under insecticide-treated nets. That may be the null hypothesis. You do not think whether they sleep under the insecticide-treated net or not has a way of influencing whether they have an increase in malaria or not. So you've stated your null hypothesis because you've detected a problem, you've stated your null hypothesis. Now your job is to carry out the experiments, designing the experiment to be able to accept your null hypothesis or to reject your null hypothesis. All right. You remember there's this story, you know, many years ago in the UK, I think John Snow, you know, sometimes considered as the father of epidemiology, he realized that a particular locality in London, they had a high rate of cholera. Let's say neighborhood A, no cholera. Neighborhood B, there was a cholera, serious outbreak of cholera. So that was the problem. The problem was an outbreak of cholera. He started investigating, and what did he find out? He found out that the tap that was in community A that was having this cholera was infected with water from sewage. So because the tap in community B that has cholera was infected with sewage, the people drinking from that tap had a high increase of cholera. So what did he do to solve that problem? He broke the head of that tap in that community B so that nobody would drink from that water anymore. And that was what helped to solve the problem of cholera. You know, so his null hypothesis would have been there is no association between cholera and their drinking water. But from his finding, he now realized that there was a sharp association. So it means that he would reject his null hypothesis that says there's no association between cholera and their drinking water, because the research clearly showed, or his findings clearly showed, that the water they drink significantly impacted the prevalence of the cholera. So you state a problem, you formulate the hypothesis, and you have to design the experiment for that. So whatever experiment you design would be quantitative, qualitative, mixed method, experimental, observational, depending on your hypothesis and what you want to get out of the study. I will be looking at all these different, study designs. Then when you have done that, you collect your data. After you've collected the data, you can analyze the data. Then from the analysis, it provides a summary for you. Then you're able to draw conclusions. So this is what the scientific method, looks like. So the forms of research methodology we'll be looking at: the qualitative, the quantitative, the mixed method, the experimental, and the observational in the context of this session. So for the qualitative, it focuses on subjective experiences. What are subjective experiences? They are not things you can measure numerically. You can't measure an individual's perception, feelings, thoughts, their interpretation of an event, their experiences of an event. You will not be able to measure quantitatively things like that using, questionnaire, using online survey tool. It's difficult. So when you want to do a study where you're going to be exploring subjective experiences, things that has to do with their perception or how they feel about something, then you're looking at a qualitative research approach. I remember in my center, there was this study we did where we looked at youth's experiences of violence during that militancy period. A lot of youths lost their family, lost their loved ones, and the rest of them. I remember even my office then had some bullet holes through the walls because that particular office was almost close to where the shoots, but it's covered now. But during that time, you can actually see holes pierce through my office, walls. It was really terrible. So after that period, we did a qualitative research where we looked at the youth's experiences of violence, at that time. And you can only measure things like that, subjectively, because you're looking at their experiences, you're looking at their feelings and all that, not things that you'll be measuring. Oh, how many feelings do you have? Or, so you won't be able to measure that. So once you're beginning to look at a study, in such approach, then qualitative research method will be your best guide. And most often the social scientists, the anthropologists, the psychologists, they use this approach, of research because their aim is to gain in-depth insight about a phenomenon, about an event, about an occurrence, about a circumstance that exists or that have happened around them. So they are going to be asking people using interviews, focus group discussions to be able to know, what their experience is. And I have an example here. Imagine a researcher conducting a study on the impact of social media on self-esteem. The impact of social media on self-esteem, Instagram, WhatsApp, and the rest. How does these platforms influence self-esteem, influence their personal experience, their perceptions? These things, you may not be able to put numbers to them. So as long as perceptions are there, experiences are there, feelings are there, subjective, you should be looking at qualitative. Then the other one is quantitative. That one is numbers, where you're going to be doing a lot of counting. How many times does this occur? How many times? As long as there's a number to it, you want to know the number of times something is occurring. It has nothing to do with feelings, experiences. It has to do with number. It has to do with data. It has to do with counts. Then quantitative method is the approach to use, because now you're looking at quantity. You're looking at size. There's no size in experience. There's no size in feelings. So that's why they are qualitative approach. But when you're talking about quantitative, you talk of quantity, you talk of number, you talk of size, and most of the time, the statistical techniques are usually used, to draw up, conclusions when it comes to these quantitative approaches. An example that I stated here can be, imagine there is a new teaching method to enhance students' performance. You can measure students' performance. You can measure it. Give them a test. You'll be able to tell whether they score 20% or 30% or 100%. You can measure students' performance. That's why it's quantitative. So there's this new method in teaching. So you're doing a study where you introduce the new method, you gave them a test before you introduce the new method. Then after you introduce the new method in teaching, you gave them another test before and after, or pre and post. So you're able to get the test scores before the new way of teaching. You're able to get the test score after the new way of teaching. With the test score of before and the test score of after, you'll be able to tell whether the new teaching is effective or not. So if the test scores after the new teaching or after the intervention was better and is statistically significant, then you would be able to tell that the new teaching method was effective. So you can measure these things using quantity, using size, using numbers. So once these, quantitative aspect is in view or is in play, then you're looking at the quantitative research, approach. And just to add that if you're using this method of association, you're doing before and after. If it's numeric that you're using to test the score, let's say you're doing an average of the score before, an average of the score after, then you're going to be using the paired t-test to do that association. So the mean score before the new intervention, the mean test score before the new teaching method intervention, and the mean test score after. So these are the same population. You're testing their average test score before the intervention and after the intervention. So you're going to be using paired student t-test, not independent, because they are the same before and after, paired. But if the test scores are measured in percentages, not in average, they are measured in percentages before and after, you're going to be using McNeema chi-square. McNeema chi-square is a type of chi-square that is used when you're measuring differences in proportion before and after an intervention. I just thought I should add that. All right, for mixed method, that's simply when you're combining the qualitative and the quantitative together. Sometimes there are certain studies that you may have to combine, and I will use my PhD thesis as an example. My PhD thesis, I'm actually looking at strategies that can motivate vulnerable population to self-test for HIV/AIDS. And I have the quantitative aspect, I have the qualitative aspect. And you'll find out that it's not easy to measure strategies quantitatively. So I added the qualitative aspect to that study so I can measure strategies. So for that qualitative aspect, I think I have completed the interview. I'm actually interviewing female sex workers. The female sex workers are part of the vulnerable population. So I have completed the interview, I've finished the transcription, the thematic analysis is ongoing right now. So the quantitative aspect alone could not capture everything I needed for that study. So I had to include the qualitative aspect. So it's actually a mixed study, all right? So another example that I have here is, for example, you want to measure patient satisfaction in the healthcare system. You have been hearing, as a policymaker, as the director of a healthcare facility, that the healthcare workers are not treating the patients well. So what did you do? you administer a questionnaire to measure satisfaction. Of course, you can measure satisfaction. There are validated tools that you can measure satisfaction quantitatively using a Likert scale. Are you satisfied with this, blah, 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 blah? Strongly agree, agree, undecided, disagree, strongly disagree. Yes, you can measure satisfaction quantitatively. So you administer a questionnaire before the intervention you want to carry out. Maybe train the nurses on teaching them how to relate with patients and the rest. You measure the patient satisfaction. And after the nurses have been trained, the doctors have been trained, other health workers have been trained, after 6 months, you administer the same questionnaire and you see whether there has been an improvement quantitatively in the patient satisfaction, probably from 40% to 60% or more. But if you also want to do this, qualitatively, okay, you would have to also gain patients' experiences, not satisfaction now, experiences, how they were treated, how they felt when they came the first time in the hospital, when they spoke to the doctor, how did the doctor make them feel? These things, you can't measure them quantitatively. So these things, you have to measure them qualitatively by interviewing them. Then later you can actually analyze, using, thematic analysis to get the main theme and the sub-themes, and the main quotes. Okay, so this is where mixed method, come in when you are unable to use one approach, in getting your result in your research objective. So for the experimental, you're establishing a cause and an effect relationship. So meaning you want something to happen and you're adding what will make it happen. So that's an experimental research. For example, diabetic patients, all right? There's a new drug in town and you want them to get better. So you are introducing the new drugs to one group, and to the other group, they continue to take their regular drug. And after a while, you measure their HbA1c, which is the test that you can use to detect if they are improving in terms of their blood sugar level. So the one group, they are taking the new drug, the new experimental drug. The other group, they are taking the regular drugs that they normally receive when they come for checkup. Then after 3 months, after 6 months, their HbA1c is checked, because you do HbA1c every 3 months. Then after the 3 months you do it, you may realize that the HbA1c has dropped for those taking the new medication compared to those taking the standard or regular medication. So if the HbA1c improved, then you can tell that the new drug is effective. So that's an experimental. So whenever you want to do something where you're going to be adding into the group to influence an outcome, then you should be thinking experimental. All right. Right now, as I speak to you, we are actually doing a clinical trial in 4 states. We're doing it. I think that was part of why Bill Gates was in Nigeria, to actually monitor that project, because the Bill and Melinda Gates are actually funding that project. We're doing it in Kano, Port Harcourt, Kwara, and Lagos. And I'm the data officer for Rivers. So what are we trying to do? It's actually a study that looks at postpartum anemia. So women that have anemia after they give birth, their blood level is below 9.9. So The standard care is to give them tablets. That's the standard care. They take tablets, for almost 6 weeks, and it builds up their blood. But there's this new intravenous drug, 200 ml. You just infuse the woman once, and that's it. And her blood will keep building over time. Just one treatment. So we are looking at the effectiveness, of the IV over the tablets. So we are putting something into the system to measure an effect. As long as you're doing something like that, it's an experimental research. For observational, you just watch. You are not influencing anybody. You just watch. For example, one of my studies, I did an observational research where I was looking at how many, churches, hit to the WHO recommended level of 85 decibel of sound pressure level coming out of the loudspeaker. It was part of one of my master's thesis. So I don't have to inform the church that I was coming. I just carry my decibel measurement and my notebook. I attend the service like a regular member. I just sit in the congregation. So what I normally do from my experience of sound engineering, I know the spots where to measure the best sound pressure level. So I just, go to the service, and during the praise and worship, I will measure the decibels. During the word, I'll measure the decibels. And during the closing, I'll measure the decibels, and I'm able to do an average. And that average will tell me whether they are maintaining the 85 decibel, which is WHO recommended level. Nobody knows I'm there. It's an observation. I just go there and observe. I'm not influencing anybody. I didn't speak to the sound engineer that I was coming, which will now make him, reduce his sound pressure level and all that. No, it's an observation. Occupational, health experts do that a lot, especially when you want to find out whether a company adheres to different, guidelines in terms of occupational hazard standard. So you don't even inform the company. You just go there with your checklist and you're watching them. Those that are climbing high, those that are driving cranes, are they wearing safety shoes? Are they wearing safety caps? Are they wearing safety jacket? You're not talking to anybody. You're just moving around and observing. All right. Those that are in the field of the environment, that measures the natural habitat. Sometimes they can go into the forest and be watching monkeys, be watching chimpanzees. They don't have to speak to them. They don't have to talk to them. They are just observing their behavior, observing the behaviors of primates, how they feed, how they interact, how they relate with one another, how they make noise, how they behave when a threat comes into the environment. You see that a lot in National Geographic TV. These people that video these things, most of them do it for research purposes. So that's what observational. So if you're going to be doing something where you're not going to be influencing anything, you're just observing what is happening in the natural environment, then you should think of the observational research method. So consideration for choosing the right methodology. Now, we have to appreciate the fact that it is crucial, for conducting a study that produces valid and reliable results. A study that promotes reproducibility, especially in our time now where we have open science, open data, where people want to use your data and replicate your study. So you have to make your methodology in such a way that it is reproducible, in such a way that people understand what you're doing. You don't just go and just do anything you like and come out. Okay, and some of the factors that will help you achieve this are paying attention to your research goals, paying attention to your research questions, paying attention to your data availability, paying attention to your resources, the resources you have to carry out this study, and also ethical consideration. So we will look at these five issues right now. So in terms of the research goals, this helps you to define the purpose and the desired outcome of your study. It guides you, especially in selection of a suitable methodology. Because at the end of the day, you want to be able to select the right methodology for your study. So the research goal helps you achieve this. So you can have exploratory goals, you can have descriptive goals, you can have experimental goals. Whatever goals you have, based on that goal, you should be able to know what methodology to use. So for exploratory goals, you explore phenomenal experiences. I've mentioned this before. So whenever you want to gain a deeper understanding of how things work, how people feel, how they react, their experiences, their challenges, like I mentioned, initially, then you should be looking at the qualitative research method. And qualitative is from the word qualia. Okay, and qualia is defined as instances of subjective conscious experience. And what is subjective? It refers to the emotional and cognitive impact of a human experience as opposed to an objective experience, which are the actual events. In other words, whenever you're looking at measuring the emotion, I'll give you a very good example. In my center, there's a research we did, breastfeeding experiences among HIV positive women. Breastfeeding experiences, and we did that study in 3 countries, in the United States, specifically Florida, in Canada, specifically Ottawa, and in Nigeria, specifically Port Harcourt. So we looked at Black women living in Canada, living in US, and living in Nigeria. What are their experiences in breastfeeding, especially HIV positive mothers? And I know some of you don't know this. WHO recommends that a mother that is HIV positive can exclusively breastfeed. Exclusive breastfeeding means you don't mix. There's no mixed method. You don't at one time give the baby formula, and another time you give the baby breast milk. If you mix feed, the baby is susceptible to being infected. So you have to do exclusive breastfeeding or exclusive formula feeding. You don't mix if you're HIV positive as a mother. But note that HIV positive mothers, they are always on drugs to subject or reduce the viral load. In Nigeria, because of cost of baby milk and the rest, a lot of HIV positive mothers, they do exclusive breastfeeding. It's cheaper. The milk is there, it's free. Baby milks are very expensive, so they can't afford that. But in Canada and USA, you don't exclusively breastfeed. The government provides baby milk for you, free. So if you're HIV positive mother, you have baby milk free in Canada and US, but not in Nigeria. In Nigeria, you pay for it heavily. So in Nigeria, the mothers breastfeed. But in Canada and US, they have to use baby milk. Now, your mother-in-law is with you in Canada or in US to do what they call omugo. For those of us in Nigeria, when your kid gives birth, the mother goes to assist, the daughter to take care of the baby, to bathe the baby and teach her techniques on what to do, to make the baby healthy. So we call it omugo. So in Canada and the US, imagine your mother-in-law comes or your mother comes to stay with you and she's wondering, why are you not breastfeeding? So that psychological trauma of having milk in your breast and you can't breastfeed, the psychological trauma that your mother-in-law or your mother will find out that you're not breastfeeding your baby because you're HIV positive. So we needed to study these experiences, and you can't get this quantitatively. You can't measure it in numbers, you know? So it was a mixed method study. So a huge part of it was qualitative because we needed to measure this emotional and cognitive impact of their experience of not being able to breastfeed when they really want to, because of the context of the environment where they are living. You know, and how we're able to get this data is through in-depth interview. We interviewed these women one-on-one. And in some of the experiences, some of them will even break down and start crying, which is why when we submitted this study for ethical approval, especially the University of Ottawa ethical approval insisted that we bring in a psychologist in the team, because they know that when you're interviewing these women, because of the experiences they have gone through, some of them will just break down and cry. And that is where you need the the expertise of the psychologist. They will not have to come in to calm the women and all that, do what they know how to do best, then you can continue the interview. So when you're looking at this sort of approach in your research, please, you have to go for the qualitative aspect. But when you're looking at describing numbers, counts, size, prevalence, meaning, you know, checking the number that have a particular condition in a population, or incidents, measuring this number over time, then you're going to be looking at the quantitative aspect. So once your research goal is descriptive, you want to describe number, you want to describe quantity, you want to describe size, okay, then you will be looking at quantitative research. Okay, so the quantitative aspects also involve statistical processes, because you're going to be calculating prevalence rates, associated factors, and the rest of them. So in this sort of research method, you're going to be using surveys, questionnaire, both virtual surveys, you know, sometimes you can use experimental method and all that to look at patterns, relationship, trends, and the rest of them. So for explanatory or experimental, it's when you want to establish, like I said before, a cause and effect relationship, then you can do an experimental. A very popular one is the randomized control trial, where you randomly put a group in the experimental, like I mentioned before, testing a particular diabetic drug to see whether it is more effective compared to the standard drug. So the moment you have in mind that you're going to be influencing the study, because you're going to be putting something in the environment that is going to influence the output, then you're thinking of an experimental research. Okay? Apart from the randomized control trial, there's one they call the quasi-experimental. Quasi means false. So anytime you see a quasi-experimental, it means that the researcher is not able to do a true randomized control trial. A true randomized control trial is where you use drug, you know, to test the effectiveness of a new drug against a placebo. But for quasi-experimental is false experimental, you're basically doing like a pre and a post, mainly testing a new teaching method or testing, something that has nothing to do with drugs. That one, it's quasi. So any intervention you're doing that does not have to do with drug, we call it a quasi-experimental. The randomized control trial, most of the time, deals with treatments, deals with drugs. So the next one is your research questions. So what kind of questions are you asking? What kind of inquiries are you asking? So we can have the qualitative research questions. We can have the quantitative research questions. So let's take a look at those. Okay, so qualitative research questions are suitable for seeking experiences that are emotional. And I've mentioned this before. For example, what are the factors influencing consumer decision-making in purchasing luxury goods? You're going to be interviewing people. Why do they buy luxury goods? Trust me, you can't get this by using questionnaire or by numbers, because you're going to be asking them a lot of questions and they're going to be telling you, because most of this has to do with feelings. Most of these may have to do with their childhood experience. Most of these may have to do with a lot of factors that you can't capture using paper. So you have to talk to them freely. You have to dialogue with them. You have to brainstorm, with them. Another one may be to look at employees, how they perceive work-life balance in their organizations. So for an employee to tell you about their work-life balance, trust me, you can't capture all of those experiences using paper. You can capture them by interviewing them. That's where you will get the richness of the data, because they will be able to provide detailed narrative that will help you understand the complexity that lies inside work-life balance, or the complexity that lies inside their decision why they always buy expensive things. So if your research questions are quantitative, like what is the prevalence of tuberculosis among vulnerable population? I mean, that is quantitative, that is numbers. Prevalence is numbers, percentages. What is the quantity of tuberculosis? If you have 100 people in the population, how many have tuberculosis? That's prevalence. So if you have 100 people and 20 people have tuberculosis, it means 20% of the vulnerable population. When I say vulnerable population, I mean female sex workers, injection drug users, adolescents, distance truck drivers, and the rest of them. These are men who have sex with men. These are vulnerable population. I know I use a lot of vulnerable because I have been working a lot with vulnerable populations for over 15 years now. I have over 15 years experience working with this group of people, especially female sex workers. So pardon me if I use examples of them, okay? So if you want to measure prevalence, that's quantity. So you are actually asking a quantitative research question. And so you're going to be using a quantitative methodology. If you're going to be moving further, because if you just ask what is the prevalence of tuberculosis, that is descriptive. You're just describing numbers, the percentage. So if you have 20 persons that have tuberculosis in a population of 100, that's 20%. That's descriptive. But if you want to go further to look at inferential or, the association, then you can be asking questions like if there is a relationship between employee satisfaction and their job performance. So like I said, there are tools to measure employee satisfaction. There are validated tools. At the end of the day, when you score those tools, you'll be able to tell whether they are, poorly satisfied or averagely satisfied, like moderately satisfied, and all that. And you can also measure job performance, because there are certain parameters that you'll be able to measure quantitatively to tell whether they are doing their job better or not. Or you want to look at online shopping preferences. You can measure that quantitatively, okay, to see whether their age, that's their demographic, their age, their gender, their educational level, influence where they shop. So you can, the online shopping preference can be measured. Are they shopping in Konga? Are they shopping in Amazon? Are they shopping in Jumia? It can be measured quantitatively. How many of the males shop in Jumia over Konga? How many of the females shop in Amazon over this? When they shop, what do they buy? Glasses, shoes, jewelries, lipsticks. So these things can be measured quantitatively. All right. So if these are your kind of questions, then you're looking at a quantitative research approach. So the other one now is the data availability. So in your study, you're going to be looking at whether you're going to be using existing data, which is secondary data, or you're going to be using new data, which you're going to be collecting. So for existing data, I don't know if you've heard of DHIS2. You know, for those of us in the health sector, it is an open source web-based platform. You know, it's also referred to as the Health Management Information System. A lot of health centers in Nigeria, they have it. And they put data inside there every day. It's a large database. Large, very large database. DHIS2 is found in 80 low and middle income countries, including Nigeria, you know, and 3.2 billion people live in countries where this tool is used. So it's a huge, huge database, all right? And it's been helping to improve data reporting in Nigeria, you know. Another secondary data, this is popular DHS, Demographic and Health Survey. My PhD, I am using demographic and health survey data for the quantitative aspect. I am not collecting real-time data because I need a data from a lot of, so I am actually using data from I think between 32 to 38 countries in low and middle income countries. So I'm actually doing a very large, you know, statistical analysis, very large. And this data for each country, I'm looking at data from 5 to 10 years. So my DHS database is over 24 gigabytes. So I'm going to be using a lot of statistical processes, machine learning, geographic information system, inferential statistics, weighting of the data, different methodologies to be able to analyze that big data. All right. So for some of us that your supervisor will allow you to use secondary data, this is a good place to go to because it has a huge archive of database. But of course, you would have to ask for permission, you know, to be able to use it. You can't just go in and get the data like that. You have to write them. They would ask for the title of your research, the objective of your research, and you know, from there they will validate what you're doing and they'll be able to make that data open to you. So if you're not using secondary data, sometimes you can use new data. So if you're using new data, it means you're going to be designing, especially for quantitative, you're going to be designing a questionnaire, or if you're not using physical, you're going to be using online or virtual. A lot of people use virtual data collection too now. Not many people are using questionnaire anymore. Like this study that I told you about that we're doing in 4 states, we're actually using RedCap for the data collection, you know. So RedCap is what we are using. For the one we did in my center, the HIV, the feeding among HIV positive women, we used Qualtrics for collecting the data. There are other data collection. I've used Google Form, I've used SurveyMonkey, but apart from that, there are other ones you can use mobile. So It depends on what you want to do. All right. So, but that is for the quantitative. For the qualitative, you can do group discussion. You can do in-depth interview, depending on, like my study now, the one I'm looking at, strategies that will improve HIV self-testing. You know, HIV self-testing is not very prevalent in Nigeria now. What most people do, if they want to do HIV testing, they just go to a health center and test. But the group of people that I work with, which is the vulnerable population, they are always stigmatized, especially female sex workers. People don't like identifying with them. They think they are very terrible people. These are one of the nicest people that I've met in my life. Very nice, and they have very good hearts. But because people don't know them, we stigmatize them. And because we stigmatize them, they don't go to regular places that people go to. Imagine going to a health center to tell the healthcare worker you want to test for HIV. And you know, you will provide data now, your occupation and all that. You know, how do you want to tell the health worker that you are a female sex worker? Of course, the health worker will even be biased. Even when the test is negative, they will say it's positive. Because the fact that you've told the health worker you're a female sex worker, he's already biased. You're a female sex worker. This one go day positive now. Do I need to test? You know, so we are looking at whether this group of people can take up an innovative method of self-testing. So it's actually a test kit, but you test yourself at home. You don't have to go to a health center. So my study is actually looking at things that will make this group of people self-test in their home or in their brothel or wherever they are, you know, so that they won't be stigmatized when they go to a health center. So it's actually a study that will provide a lot of information, especially to policymakers and people that sell these kits, to be able to know how to market them and get effective patronage, you know, from this group of people. So because this study is sensitive, I am doing only in-depth interview. I did only one-on-one interview. I didn't do group discussion because it's a sensitive topic. I'm asking them, have you tested for HIV? When did you test for HIV? You know, all those sensitive information. If you do focus group discussion, you will not get anything. Nobody will talk to you. When you begin to ask them, have you tested for HIV? A lot of them will just be looking at you because they don't want their neighbor to know whether they've tested, you know? So I did in-depth interview only, one-on-one. But if you're doing a study that is not, you know, is not sensitive, you can do in-depth interview and also do focus group discussion too. You know, like that study that has to do with violence experience of youth. It was a focus group discussion. It was not an in-depth interview. We brought all these youths in a room and we were interacting with them one-on-one. Each of them will just talk about their experiences. There's nothing stigmatizing about that. So that one, you can do a focus group discussion. So that's, you know, two ways you can actually collect qualitative new data for qualitative study. Okay. Well, someone said that I think it's a little exaggeration to say health workers will say it's positive when it's negative just because the client is a sex worker. Okay, I take that back, but I am also talking from experience. You know, most of the time, especially health workers that are trained in relating with vulnerable populations. Health workers that are not trained in interacting with vulnerable populations always have this problem. So for those health workers that have been trained to work with vulnerable populations, most times they have that cautiousness to actually know what to do. Okay, so that is what I would add. It's just an example. It's not like it is carved in stone. So researchers, in terms of resources, as a researcher, you need to consider the available resources that you have. One of them is time. Second is your budget. The third one is your human resources, because these three things will actually influence your research method so that you can actually tell which research method you want to do based on your time, based on the budget, based on the human resources. So we'll look at them one after the other. We are almost wrapping up. We're almost in the final phase of this presentation. So just hold on for a few more minutes and we'll be wrapping up. Thank you. So let's look at time. Time for that study has a role to play in the study design. So the study design will be able to tell you whether you have sufficient time to complete that study or not. For my school, at the University of Port Harcourt, master students, undergraduate students will not likely do longitudinal studies. They will not likely do cohort studies. Because cohort studies, you will have to follow participants over time. You have to follow them over time. And your master's program, your bachelor's research has timeline. So we can't afford to allow you to do cohort studies where you have to follow participants over time for 6 months, 1 year, and the rest of them. You don't have that time. So you find out that most of the studies in bachelor's, master's, they will fall on either a cross-sectional study or a case control study most of the time. But some PhDs, they may allow a cohort study, because a PhD, you may have 4 years, like me now. I have, my PhD is research-based. I'm not doing any coursework. So I have all the time to do research, although I'm not doing a cohort study really. But for a PhD, you may have all the time, so you may do a longitudinal study because you have that time. So let's look at a few, study designs, and you can see how that may influence your timing. Yeah, someone says sometimes there's stigmatization because of our cultural, religious disposition. I agree. So everything I said initially was based on stigmatization. And I've seen a lot of health workers stigmatized. And most of the time, when you have a particular profession, they may just have a perception of you even before they do what they need to do. Someone says for the Likert scale, strongly agree, undecided, disagree, as long as they're measured at interval or ordinal level. They are actually measured in an ordinal level. Likert scales are measured in an ordinal level because they have an order, they have a pattern. You'll be getting the slides, you'll be getting the videos, okay? If you need the slides, you're going to send me an email. Sorry for that breaking transmission. I'm going to be sharing the recording in the different platforms and the slide, but you can send me an email if you don't get it. So let's progress. We'll take question and answers later. So for a cross-sectional study, very quantitative, it has a timeline. So you're going to be taking whatever you're testing. Let's say, for example, noise-induced hearing loss. You have people that are exposed to noise, and you want to measure them to see how many of them have noise-induced hearing loss based on their exposure. So you are collecting the data at one time. So the timing for that is very short. All right, so cross-sectional study, if you don't have a time, if your study is in few weeks, then cross-sectional study is the best for you, because you're going to be meeting the participants that are exposed, then you're going to be collecting the data at that time. Sometimes you can collect your data in 1 day, 2 days, 3 days, and you're done with collecting your data for a cross-sectional study, because you just want to meet those that are exposed and measure those that have the outcome that you're interested in. So, for example, prevalence of malaria, people that have typhoid, all you need to do, meet people that are exposed and test them. At the end of the day, you'll be able to tell, out of 100 people that are exposed, 20 people, 30 people, have TB or whatever. So you are getting your data at that time. So this one, if you don't have time, you have 2 months I think this is the kind of study design you'll be doing for quantitative. All right. So the other one is case control. This one may take a little time, but if you're going to be doing this, you're going to be using medical records most of the time because you are interested in the cases, those that already have the condition. All right. So if you use medical records, you can go into the health center and check for those that have a particular condition that you're interested in. Let's say for children that have respiratory tract infection, you pick the folder and check, pick all the select all the folders of children that have that was diagnosed for respiratory tract infection. Then you begin to check the folder to see what are the causes that the doctors wrote that would have been responsible for the respiratory tract infection. You can also check folders of children that don't have respiratory tract infection and also see what they're exposed to. You can use medical records. You can also interview. Let's say those that have lung cancer. They already have the condition. You can interview them backwards. It's usually retrospective. How long have you been smoking? Or first you have to find out if they smoke or not. How long they smoke, how many sticks of cigarette they take. So they have the condition. Okay, someone was asking the difference between descriptive and quantitative. The quantitative is the umbrella name. Descriptive is one aspect. Quantitative research is numbers. Is divided into descriptive, inferential, experimental. They are all quantitative. So quantitative is the big brother. Inside there, you have the descriptive where you just count the numbers. You have the inferential where you do associations between the independent and the dependent. Then you can have the experimental where you are influencing the outcome. All right. Okay. So for the case control that I mentioned, they have the cases like for those that have lung cancer, you begin to ask them questions retrospectively backward to see what they were exposed to that made them susceptible to cancer. So this may not be too long. So this can be doable if you have short time. All right. But the one that is very long is cohort, like I mentioned. If you don't have time, please don't do a cohort, because a cohort, they don't have the condition that you're interested in. They don't have lung cancer. They don't have malaria. They don't have anything. Okay, you, the researcher, is responsible for the exposure. You expose them to whatever you think. Like I remember my bachelor's study. I did a study where I looked at the histotoxicological effects of a plant, Phyllanthus amarius, in the liver of Wister rat, this white big rats. I think I did a presentation of that finding at Stellenbosch. I think it was in November, December, and they were really, really, really interested in that, in the findings. So what I did was I had about 42 white rats, also called Wister rats. I extracted the plants. So for some portion of the rats, I was giving them high doses of that plant. For other portions of the rats, I was giving them low doses of that plant. For other portions, I was giving them just water. And I followed those rats for months. Every 2 months, 3 months, I would dissect the rats, get their liver, and check the histopathological damage. That's a cohort study. It takes time. I am the one exposing them to toxicity, because some of the rats, I was giving them lethal dose of that plant, because I had to check my LD50, my LD100, LD50, LD100. These are the dose that you would give. LD100 is the dose you will give. All the rats will die. LD50 is the dose you will give. 50% of the rats will die. So I did all those kind of tests. So I was able to know my LD100. So I didn't give LD100, of course, because I don't want all my rats to die. So I gave LD50 for some, which is lethal dose. Then I gave, minimal dose that is not lethal. Then I gave water. and I followed them over time. Then I tested. And at the end of the day, I saw that most of the rat had toxicity in their liver. But the interesting thing is, after a while, the liver was able to clear up the toxicity. So people take these plants to treat malaria. So I was able to tell that fine, if you take these plants at very high doses, the extract, they would cause some toxicological changes in your liver. But after a while, the liver has the potential to detoxify the toxicity of that plant. So if you're going to be doing this kind of study, it's a longitudinal study. So if you don't have 1 year, 6 months, please don't go for this type of study. The same thing with experimental, because you're going to be following people up over time. You're going to be checking the effect of the drug over time. You're going to be checking the effect of the intervention, whatever it is, over time. All right. So this is how the study design can influence the time, even for qualitative. Qualitative will depend on you. Qualitative is almost like the cross-sectional. You can do your interview right there at that spot. Like the in-depth interview for my qualitative aspect, it didn't take long. Sometimes you can even interview 5 people the same day, 6 people the same day. So qualitative doesn't take time. It's usually short span. Qualitative studies are not longitudinal. You don't follow people over time. You collect your data at that particular time. The next one we'll look at is the budget. You have to look at your budget. Okay? Experimental design studies have huge budgets. So if your research is not funded, please avoid experimental design studies, especially for students. I always tell my students, avoid studies that are experimental. We don't even allow you to do experimental for bachelors and masters. All right? Even if you're going to do it for PhD, ensure you have funding, because they are large scale. I mean, look at this study we are doing. The Ivan PP study, the clinical trial study. We're doing it in 4 states. The budget for this study is over $3 million US. You can't do that study without budget, without funding. It's an experimental design study, and it's a huge budget. So please, your budget will guide your study design. If you're funding the study from your pocket, please look at cross-sectional studies, case control studies. Those studies are, budget you can actually carry. And also as a student, let me say this before we go to human resources. Please don't be overzealous. Don't be overexcited. Okay? There are certain ways you can actually achieve the same result without spending so much money. A few years ago, a student met me. They want to do a study on the prevalence of fibroid. And the student wanted to do a scan for 500 women to check whether they have fibroid or not. And I asked the student, who is going to pay for this? He said his parents. You don't need to scan 500 women to get prevalence of fibroid. Come to our teaching hospital, University of Port Harcourt Teaching Hospital. We have folders for 5 years, 10 years of women of reproductive age that have visited the clinic. Most of them have fibroid. So come to the clinic, we will give you folders for 5 years. You go through those folders. By that 5 years, you'll be able to tell the incidence of fibroid. So you don't need to scan. You don't need to pay for scan. These women have already done the scan. They have already been validated by the doctors. So you can achieve the same thing without spending money. So this is wisdom for our early career researchers. And the final one for this category is human resources. Please do researches that you have skills for. If you don't have skills for them, learn. If you don't want to learn them, consult experts in the field. For me, I am not a qualitative expert, but I'm a quantitative expert. For my qualitative aspect, my supervisors are guiding me. One of my supervisors, Professor Sibia, she is a qualitative expert. My other professor, Professor Ladimeji, he is a quantitative expert. So my lead supervisor is a quantitative expert. My co-supervisor is a qualitative expert. That's why I can do a mixed study. Don't go and do a qualitative study when your supervisor does not have any experience of it. Please, if you're going to do a qualitative study, either you have experience or you have a supervisor that have experience. If not, you're going to mess up your work. So please get the right people for the right study. So ethical consideration, this is the final section for this presentation. For ethical consideration, consider the participants' well-being, researchers' work, bias. I know a lot of us have heard of the Nuremberg Code, okay, which has to do with the atrocities committed by physicians. Imagine physicians, you know, most of the anatomy textbooks, most of the anatomy study, you know, dissection of the body, we actually done on live people without anesthesia during the Nazi camp. I mean, there were a lot of experimentation in human subjects that were alive without any form of anesthesia. I mean, this was terrible. So as a result of that, they brought in the Nuremberg Code in 1947. And the whole idea is to ensure that you get voluntary informed consent from participants before you collect their data. And the code helps to minimize harm. Every research you do, you have to get consent because you have to carry the participant well-being in mind. Okay? So the final one is the researcher bias. You as a researcher, there could be some bias as you're carrying out your study. So you have to know these biases, and I will mention them briefly. The first one is confirmation bias. When a researcher selectively seeks, interprets, or presents information that confirms their preconceived notions or hypotheses while disregarding conflicting evidence. And this happens a lot when you're working with female sex workers, especially those that are HIV positive. As a researcher, you may be biased, thinking, oh, because these are female sex workers, their HIV history can be very damaging. Their HIV history, their health status, and all those kind of bias may be in your mind, and you may be relating with them with that bias, and that may influence your study. The other one is selection bias. I remember some students came to me a few years ago. Their supervisor sent them to me. They were doing a study on waist circumference and hypertension. And I was looking at the study, and there was no association between waist circumference and hypertension from their study. And that was unlikely because a lot of literature say there is a relationship between waist circumference and hypertension. And these are medical students, so we are not expecting them to do novel studies. So how come? So I now asked them, what group of people did you collect your study from? And I realized that, and I was told, they collected their studies from their colleagues, from their friends. I mean, how would you be doing a study on hypertension and you're collecting your study from young people? That's selection bias. You've collected your sample from the wrong participants, so you won't get the right results. Observer, bias, occurs when the researcher's expectation or prior knowledge influence their observation, especially the study on noise-induced hearing loss, where you go to churches to observe their sound pressure level. Sometimes you may have a bias and say, oh, this church that has this large sound, they will have plenty people that have hearing loss. So as a researcher, when you're doing the study, you may be biased, thinking that churches you visited, that their sound pressure level is high, they may have more people with noise-induced hearing loss. That's an observer bias. Publication bias, where publications are done in journals that are poorly reported, and that will now skew the findings of that study. And the final slide before question and answer. Reporting bias. You know, when you want to publish your work, you selectively pick the things you want to publish and hide the others you don't want them to see. That's reporting bias. Please, when you do your study, report everything. Don't hide some of the findings because you don't want them to see it. You now promote the ones you want them to see. Experimental bias is there too. Like in this our study that we're doing, where some of the women, we give them intravenous, you know, to build their blood. Some of them, we give them tablets. Sometimes you do the random selection, although the randomization of these women is done automatically. We use an American company that has a company, they call them sealed envelope. They are the ones responsible for the randomization. They tell us which women will go to IV, which women will go to tablet. If not, we as the researcher, we can be biased. Imagine randomizing a woman that has a very low blood. Her anemia is very serious. And you randomize her and she goes to tablets. And you know that, this woman, you need to build her blood quickly. You will say, no, she should not be in tablets. Please put her in IV. Please, she's in a critical point so that her blood will build more. That's experimental bias. You are now deciding where to place women because of their condition. So that's why we had to rely on that company to do the randomization so that we as the researchers, we don't get bias. Finally, social desirability bias occurs when participants in a study provide responses that they perceive as socially desirable. You're asking them for something, and they would be telling you the ones that they want to tell you. The ones that they don't want to tell you, they will hide it because they know that if they tell you, you will not like it. That is also a bias and affects data collection and representativeness of your sample collection. Thank you very much. This is the end of the presentation, and we appreciate you for staying. I know it's a long presentation and a lot of you stayed to the end. Thank you very, very much. So we're going to be spending a few minutes in taking question and answer before we wrap it for the day. Salami slides it. Hope the slides, yes, the slides will be sent. I'm trying to see if I can see some questions. What is the ethical practice for giving out medical reports without patients' knowledge? Well, for me, you have to de-identify. You have to de-identify the medical records before you use it for research purposes. De-identify means that the patient's identity, anything that will link the patient, will not be captured. That way, you are maintaining ethics. That is one of the ways you can actually maintain ethical practice. Can one do logistic regression with variables in a Likert scale? No. For your outcome has to be dichotomous. Your independent variable, yes, fine. Your independent variable can be any number, but your outcome has to be two groups. Logistic regression works better with two groups because you want to assess the influence in one group over the other. So for logistic regression, your dependent variable, your main outcome has to be dichotomous. It has to be two groups, but your independent variable, yes, they can be any number. All right. Shed light on, I have done so on descriptive and quantitative. I've done so earlier. Yeah, okay. So please, you can ask your questions now. If I miss anything, hold on, let me, so that I can allow you to unmute yourself. Just a second. So if I don't answer the question in the chat box, please answer it. I'm allowing you to. Okay, so you can ask your questions now. Asuko, please go first.
Okay, thank you so much, sir. I'm very grateful for this. For the qualitative research methodology, How do
Yes.
you deal with some of the participants, like you are interviewing, some of them, like you talk about biases, they are kind of restrained, giving you out the information you actually needed for your research. Like I did, that was early this month, I did some research here in Port Harcourt and the neighborhood local government here in Port Harcourt. I noticed that some of the information I needed, some participants were very restrained about giving out those information. And in some cases, when you've gone midway through your questions, maybe you have like 20 questions to administer, you notice that then when they've gone through like 10, the remaining part of it, they don't want to participate again. Maybe they've run out of patience, or they tell you they are busy, they can't attend to all of those. Are you still allowed to submit those half-half answer without getting to complete a kind of one participant going through the questions you need to go through before going over to another person? I don't know if you get my question. Like you
Yes,
talked
yes,
about the bias.
yes. I
Some
got
of
your
them,
questions very well. Yeah.
yes, yes.
But in
Some
this
of
case,
them,
at Asuko, it's not really bias per se.
okay.
Eh? It's
What's this?
just that that's why before you venture into any study, we ask you to do pilots, to pilot that study. When you pilot your tool, that's where you know that the questions you're asking is because when you want to administer a questionnaire, you tell people, I need 20 minutes, I need 30 minutes, I need 1 hour. So they know from the beginning, like some of the qualitative interview we do, we tell them is 1 hour. And if you're going to take someone's 1 hour, you have to compensate for that 1 hour. That is the truth. Like this study I did for female sex workers, their job is hourly. Their clients pay them hourly. So if I'm going to take their time for 1 hour, I have to pay them for that 1 hour so that they will give me their full attention. So if you are not going to compensate for their time, most of the times they get tired. And if you had piloted your tool, you would have been able to gauge how many minutes, how many hours, and from the beginning, you let them know, it's going to be 30 minutes or it's going to be 1 hour, and they will tell you whether they have the patience to commit to that time. Not in the middle, they start dropping out. And you will not be able to use a data that is incomplete. You will not be able to use it. The only way out now is to go and look at your questions again and see which, because sometimes some questions are repetitive. Yes. I have known that, especially for qualitative study. You ask somebody question A, you ask somebody question B. Question C is almost similar to question A. They will get tired. Yes. So you have to do validity. Meet experts. Let them look at those your questions and strike out the ones that are similar. That way you have minimal questions and you're able to, focus those questions and have minimal time, for your participants to be able to answer, but you would not use half. You have to get the full questions because, how do you want to analyze that data? The fact that you didn't get all the questions already has a high tolerable error. So that is my recommendations.
Oh, thank you so much. That's very interesting. I really appreciate it. The second question quickly about the biases. You mentioned like 5 of them. How do we know that we've not committed any of those biases? Because I wouldn't know, but then if like by default we are biased in some way, though we might not be say that this is the aspect I'm being biased, but then how do we know that we have not committed any of those biases when we are administering?
You as a researcher, that's why we are telling you, you as a researcher, you know. When you're collecting the data, you will know that you are, you will know, and some of them too, you can actually use some statistical processes to actually minimize them. During the statistical process, yes, you can actually use some statistics. That's why sometimes we do what they call, multivariant logistic regression. We use that to also deal with confounders, So sometimes you would know, sometimes you can use some statistical processes to actually deal with that. Biases, you may not completely rule out biases, but the whole idea is to minimize them. That's why we teach people these things. Just minimize it. Not like you may completely rule them out, you know.
Thank you so much.
All right. Thank you. Benga.
All right. I must appreciate you for the very informative presentation. That was very informative. Thank you very much. So my question is about bias also. Basically, I know there is this problem about having a sponsor for your program, for your research sometimes, more importantly, maybe, so that could also be a form, it could also create a kind of bias because they have expectation. Now, if your findings contradict what they expect you to write in reports, probably they were looking for a kind of report that will support their product. So if eventually your research goes against what they expect you to write, and then they are trying to make you write to support what they actually wanted. So how do you deal with that as a researcher and not compromise your own personal integrity and pedigree?
Okay, yeah, what you've said is a very, very interesting aspect. And you see this a lot in drug experiments, where they have manufactured a new drug and they bring some researchers together to check whether those drugs have side effects. And these researchers, they know during the testing that probably this drug have some side effects, but they will, minimize because they want these guys to sell the drugs because they are big money for them. So all these things, this aspect has to do with you as the researcher, your integrity, to be able to tell the funders that this is your findings and you are not going to compromise on that finding. That is why you will notice that when you want to publish your work, the publication will ask you if there is any conflict of interest. That's what the conflict of interest is all about. This work you have done, is there conflict of interest in the sense that you are testing a drug, if that drug is effective or not? Is it the drug company that funded that research? Because if it's the drug company that funded that research, that's a conflict of interest. You want to make your client happy. So it has to be an independent funder. So these things are very tricky. So what I would recommend you as the researcher, your own integrity is at stake. All right.
Yes.
I have gotten recommendations. Let's say like someone, I've gotten letters like from researchers in the US asking me to validate their statistics and write a recommendation. I will validate the statistics. I will provide my recommendation. If some aspect of the statistics is not good, I will not say, oh, these guys are paying me, let me make my clients happy. No, because my name, my signature is there. I have validated that the statistics for this research is accurate and is the right statistics for the process, and it has gone out. And if the body that they're sending it to find out, that is not good for my own integrity. So I pay attention to these things. I just do what I think is right, irrespective of what the conflict of interest is.
Yeah, thank you very much. I just wanted to add something to your explanation to Azuko the other time. When you talked about providing what I would say is incentive to participants, especially for the hours spent. Because I'm also a qualitative researcher myself, my thesis, my master's thesis was qualitative, purely qualitative. So it is usually recommended that you probably don't tell the participants you are going to give them anything before you start the interview, so that you don't set in bias, like make them to just want to do it, even when they are not ready to do it.
Yes.
Then another thing that is done in my university here in the US is they make you do like whatever is it you are going to give to your participants must be far less than, like must not be something that can actually influence them. For instance, now, if you want to conduct a study, you want to interview people, and then you say, I'm going to give you $100. I'm sorry, I'm using $100. I know this is more like different people across Africa. So I'm just using dollars. So I'm not using Nigerian naira because I'm a Nigerian. So let's say dollar. If you say you are giving somebody $100, somebody who finds it difficult to make even $100 a month, and then you want to give that person $100 within 2 hours, obviously that person wants to jump on the program and just do the interview, even if he doesn't have the information that you need. So that we really have to. I know you know this, but probably
yes. I mean, you are.
I'm just saying it so that the as people will know this,
exactly.
know that you have to take caution.
Yeah, you are completely correct. So the money is not an influencer, but you have to, like, it will interest you to know that in Canada and the US, when they give you a questionnaire, they write on that questionnaire the amount of US dollars that you're going to get for filling it. That way, they are compensating for your time. So it's not that they are paying you. They make it clear that this time you're giving us, we want to compensate for it. So it's not payments. So when they know that they are not wasting their time, they will give you their full attention. So you're not paying them, but you are, like, I remember one of the studies we did. We gave the women torchlights, this rechargeable lantern. Say, take, this is for your time. It's not payment. You can't pay them for their time, but you can, compensate them so that especially qualitative studies, where you keep people seated for hours. And at the end of the day, you tell them, oh, thank you very much. Bye-bye. So yes, so we have to actually draw that line, so that we don't allow whatever we're giving them to influence their participation, but we also need to let them know that whatever time they are giving to us, that is like there's one of the studies it's a qualitative study we did where we were going to take 5 mils of blood from HIV positive people. You're taking 5 mils of blood of people that some of them are trying to get nourishment. So what are you going to give back to them? So if we're going to take 5 mils of blood, then we'll have to compensate. We'll have to give them something that, if you're giving them a card of multivitamins, if you're, something to compensate for what you're collecting from this participant, not like you are bribing them or you are luring them. So yes, I completely agree with you. We need to draw that line and make that aspect very clear, because you don't pay people to participate in research. That's unethical. Thank you. So Emmanuel, our time is really running. Emmanuel, please ask a question.
Good day, sir. Thanks a lot for the session.
Yes.
Okay, I noticed during the session that you made mention of a lot of data analytical tools and study design procedure. Like, as a young career scientist, I don't know so much on data analytics and even experimental design. Is it okay for me to contact somebody to, like, wait, these are my research questions. What tools can I use? And what
I have actually done a preamble of that. The first webinar I did, how to become a data scientist, I did a summary of that. So I'm going to have another webinar that will fully deal with this thing now that you're talking about. That's the next webinar that we're going to have. These are your research questions. What are the statistical tools to use? But I am taking it stage by stage. Now I focus on the methodology and all that. So the next one will be what you're talking about. So if you stay, I think, I don't know if you're in the Data Science Hub and other Auto8 platform, I would definitely advertise it wide and you would be able to get, but if you send me an email, I had dropped my email. So for those of you that are sending me your emails here, please send me an email if you need anything. I'm putting my email again. Okay, so Emmanuel, you can also send me an email. I can send that recording for you on how to become a data scientist. And I also have 2 blogs that I wrote for Auto8 that also deals with something like this. So before I hold that webinar, you can actually be studying this. Okay, Emmanuel.
Okay, sir. I will send you the email, sir.
All right, thank you. Jonathan, then I have Oluchi, then we could wrap
up. All right.
Yeah.
Thank you so much for this nice presentation.
Thank you.
I want to, because all this about this compensation for the time, of the participants. I want to see a way out. That would be the one. I want to raise like 2-3 issues. This should be the first one for undergraduate students. I'm a researcher at University of Agriculture, Nigeria. You see, we have for these undergraduate students, they are is a requirement for having be a Greek actually. But consider the issue of because funding, because most of them, they do all this research from their posts, from their parents, and then it's so sure, it's so certain, it's so clear that most of them do all this filling of questionnaire from their apartment or from their hostel. And then even it's difficult for because you are not supervising one, at times you may be supervising 15 students. It may be difficult for you to be following them to these study areas to gather data. And even if you are there, the expectation of these rural farmers will even be high, seeing their organ with them. They want to maybe to give them some, at least for their time, as we actually agree. But the salaries of lecturers also. You may not be able to do that actually. And the result of this is very clear that the data that we are obtaining is not actually of quality, because you are not getting actual real data from the farmers, being that is more of a cook. I don't know if you get what I'm saying. Now, the issue now is that you see most of these farmers requesting. They will tell you that, maybe they may even think that that's why that you don't promise them. Maybe think that if you want to use it to maybe doing for government or the like. They want to be paid, but it's difficult to give them that payment all around. It's difficult because most of these works are not funded. All these undergraduates, they usually have that short time. Therefore, I'm thinking, is there any way we can go around it to at least to pay for this respondent and at least to obtain quality data from them? That's one. The other one is qualitative data. I want to know the tools to analyze them, and also if you have any help that you can render to see how to analyze qualitative data. I'm sure there are some statistical analysis to analyze focus group discussion, interview, and the like. It's like you mentioned some of them. I would like to at least have more experience now to analyze qualitative data. And lastly, I raised that on the chat earlier, the Likert type scale. I want to know the type of, can we conduct differential statistics on Likert type scale, like satisfaction that you earlier mentioned that have standard scale. What are the statistical analysis that can be conducted on Liketer's scale? Thank you so much.
So much, Jonathan. So for the first one, which has to do with payments, for me, I encourage students to do researches that don't take so much people time. Anytime you're doing a study where you're going to be engaging people for 30 minutes, 40 minutes, 1 hour, it's not easy for them to just sit and be filled. So if you're going to be using a questionnaire, ensure that your questionnaire can be filled in 15, 20 minutes at most. Because your study is not a novel study for undergraduates. So I don't know how you'll be designing a questionnaire that will take 1 hour to fill. Of course, these people will get tired, So I encourage students, especially my students, keep everything you're doing brief. You can capture your objectives from your questionnaire, irrespective. The main thing is objective 1. What kind of questions are you asking? Sometimes you see students, they will design questionnaire, they will go round and round and round and round and round and round. At the end of the day, you're not able to see the essence in the questionnaire, in the sense that imagine a student asking someone 5 questions and none of those questions is answering the objective. It's a waste of time. So if that study does not have funding, they should focus on studies that don't take so much time. Because once you begin to take people's time, they'll be looking at you, you're taking my time. So that is what I recommend. The second thing is they can also focus on studies where they can use medical records if it's a health institution, or focus on studies where they will be interviewing people in the in their comfort zone, interviewing lecturers, interviewing, people in their comfort zone. So that way, their participant will not be requesting for anything because they are within the environment. But apart from this, it's not really easy engaging people time. So which is why, especially for PhD students, we recommend them to actually, source for funding, no matter how small it is. You don't have to give people money. You don't have to give, like, for example, one of my colleagues did a study on hemines, amongst farmers. But she bought them multivitamins and hemines drug. So for those that they tested that had hemines, you don't tell them, oh, I found out you had hemines, bye-bye. No. For those her study found that had hemines, she provided medication. That's her own contribution. So that is how these things work. So if they don't have funding, then they will have to look at studies where they don't have to take people's time, or studies where they don't have to do experiment or do tests, lab tests and all that. Those studies are quite expensive. Now for qualitative, you have to send me an email. I'm not a qualitative expert, but my colleague Bolu is a qualitative expert. He's even the one helping me in my thematic analysis. I have very little idea, but I'm a quantitative expert, like I said initially. So you can send me an email. I will connect you with him. All right. He is an expert. He does it very, very well. I can provide my little knowledge, okay? But not like an expert. So if you want that expert idea, please send me an email and I will connect the both of you. For Likert scale, yes. If you're using a Likert scale, it's an ordinal scale. So analyzing ordinal data, you use what they call Spearman's. Spearman's rank is used for analyzing ordinal. All right, so you can use Spearman rank test to analyze ordinal data. Hopefully in our next webinar, I will talk on these statistical tools. I will start by talking about the scales of measurement, what statistical tool to use in each scales of measurement. So I would do all those stuff. All right. Okay, thank you very much. So
thank you so much.
Yeah, Obi, I think that's Oluchi. Please, I don't know. This is the last question I can take. Obi Oluchi, and I have Jonathan. Obi Oluchi, yes. please go ahead. Yes. So that we can wrap up. Sir. Yeah, good evening.
Thank you. I appreciate you for the knowledge imparted. Please, I want to help you clear this for me. Though you say you're not a qualitative type, but I want to know if you want to carry out interview now, how many people likely be okay? I want to give it a try. Yeah. Then another one is
okay.
Another one is that
participant.
Another one is that I grew up. I'm in an environment whereby when you're researching, if you want to study challenges, you focus on challenges. If you want to study on solution importance, you focus on it. I don't know, what do you have to say? Is it right for one to both, as in carry out research on both issues and, let's say, challenges and solution? Or is it right?
Well, for the first part, which has to do with the sample size, for qualitative studies, we always do what they call data saturation. That is what we use to know. When you're interviewing people, a time will come when you know that they are telling you the same thing over and over again. That time you know that you've come to data saturation. You can actually say you want to interview 10 people, you want to interview 15 people, you want to interview 20 people. As you're interviewing and going, you may get to 15, the 15 person. When you're interviewing the 15 person, you may just realize that these people are not saying anything new. They keep repeating the same thing. That point, you know you have come to data saturation. So data saturation guides in sample size when it comes to qualitative study, unlike quantitative where you have to calculate sample size. For studies, every study you do is trying to provide a solution, meaning you have detected a problem in an environment and you're trying to provide solution. That's what a research is all about. Okay, a research is about problem solving. That is research. You find out that there's high prevalence of this condition here. How do I solve it? Like this John Snow example I gave you, he found out there's cholera here. What is causing it? There's this thing here. What is causing it? That is what a research is all about. A researcher is a problem solver. Okay, so you found a problem, you are doing that research to provide solution. So both of them intertwine. Okay, I think the last, I don't know if that's clear, Oluchi.
Yes.
Okay.
Thank you.
Thank you, Jonathan. I think this is the final question, and we'll wrap up. Jonathan, please go ahead.
Hey, my apology. I'm supposed to have raised down my hand.
Okay, yeah, all right. Yeah, so thank you. Yeah, thank you, everyone. Please, like I said, a lot of you have been dropping your emails. Sorry. Let me